And this week is Asthma Awareness Week, and Chrissie Small spoke to Dr Kyle Perrin, who works as a respiratory and general physician at Wellington and Kenepuru Hospitals, about the message that he's trying to get out into the community. Kyle is a senior lecturer at the University of Otago and, as a specialist in the field, is actively involved in clinical research with interests in a variety of respiratory conditions, including asthma, COPD and cystic fibrosis.
It's a busy week for you, isn't it?
Yeah, look, it is absolutely a busy week from the Asthma Foundation point of view, and it's just happened to coincide with a busy week in the hospital as well. And so it's just one of those things when I have I think I've got a morning free, which I should have this morning. All these clinical commitments pop up, and I'm sort of dashing around a bit this morning. But no, you've got me for a bit.
Oh, great! Look, we won't keep you too long. Now, Asthma Awareness Week. This is a really important time for people, really, to get them on track health-wise.
Absolutely, yeah.
Sorry, yep.
No, carry on.
I was just going to say, New Zealand statistics aren't looking that great with mortality rates with asthma.
No, it's actually an absolute tragedy that we still get an average of one asthma death a week. That's an estimated death rate. We don't have great up-to-date data for the last year or two, but certainly in sort of the mid-2000s there was at least 60 to 70 deaths per year on average. We think it's fallen a little, but it's still too many. One of the success stories of asthma management has actually been that overall asthma deaths now are much lower than they were back in the 1980s. So asthma treatment's improved significantly. The major issue in terms of asthma, and one of the reasons for Asthma Awareness Week, is the number of patients with asthma is actually dramatically climbing. So the incidence, as we call it, the number of people with asthma, has been steadily increasing, and that's a major concern to us because hospital admissions are also a major issue with asthma, not just deaths. Yeah.
Is there any mitigating factor as to why the rates of asthma are increasing?
It's no is the short answer. We don't know for sure. What we know is that the rates of asthma and allergic diseases in general are going up in all Western countries. It seems to be a thing that's associated with relatively affluent Western societies. So asthma rates are much lower in third world countries and aren't increasing as much. So there's various reasons that have been put forward. The use of antibiotics in childhood, fast food, obesity. There's something about a Western sort of lifestyle that seems to be increasing allergic diseases and asthma in particular. And so there's a lot of research going on at the moment to figure out why that is. But for now, at least, it's a fact of life, and we sort of have to deal with the implications of that, which is a lot more people with asthma and a lot more people sort of coming to hospital with bad asthma attacks.
Now, I guess this whole awareness week is about how people can actually manage asthma in a satisfactory manner so that they do not become acute. Is that right?
Yes, that's quite right. So we want people to be aware of a few things, actually. The first is that asthma is common. It doesn't need to, it's awareness raised from that perspective. People know about asthma. Almost everyone knows someone with asthma. We wanted to really raise the fact that it's becoming increasingly common and that it's a really severe disease for some people. And so people have this notion of asthma being a bit of a mild thing that causes a bit of coughing and wheezing. You know, you take a bit of Ventolin and everything's fine. Well, that's not the case for lots of people. Lots of kids with severe asthma are in and out of hospital all winter long. They're missing school. Their parents are missing work. And I'm an adult respiratory physician, so I have adult patients who have a similar experience. I've got a young girl who's just about to leave school, who's had last year had 5 or 6 intensive care admissions with her asthma, and she's on a lot of medication for it. So we really want people to be aware that it's a potentially really serious disease and that, yeah, it needs chronic treatment. People need to take daily medication for it, but that these bad outcomes like death and even hospital admissions are mostly avoidable if people pay attention to it and have a plan to manage it.
Right. And so it's basically it's about management, isn't it? So if people realise that the symptoms are coming on in their own well-being, that they start to use the preventer medication and Ventolin. Yeah. So it's a disease which can be managed, but it's being aware of how to manage it.
Exactly. There's two aspects to it. First of all, every asthmatic needs a treatment plan, and for the vast majority of people, that means actually regular inhaled treatment every day. These inhalers that we refer to as preventers really need to be taken on a regular basis, usually morning and night, inhaled treatments. And if you do that, it generally prevents most of the complications of asthma, including most hospital admissions. Where people get into problems is, like a lot of chronic diseases, asthma comes and goes a bit. If people are feeling fine and they've got no symptoms, they think to themselves, oh, why should I take these drugs? Why should I take this inhaler every day? It's a bit of a nuisance, and they stop it. And I had a couple of patients last year admitted to hospital with severe asthma attacks who just had stopped their treatment because they felt okay, and then they got hit with a flu or a virus, and suddenly they're in hospital. So these preventers are called preventers because they prevent attacks of asthma. So people need to take them every day if they're prescribed every day. That's really, really important. The second aspect of managing asthma is having a plan for what to do if things get worse. And for most patients, that's having a simple little thing on the fridge door from their nurse or their doctor saying, look, if you're getting more wheezy, if you're using your reliever, your blue inhaler, more frequently, this is what you do. It might be increasing your preventer dose. It might be starting some more intensive tablets treatment for asthma. It might be going to your GP and having a checkup that day rather than leaving it for a day or two. So there's a variety of things you can do to sort of step in and modify the problems when they're starting to occur.